Your questions as possible. Do stand by for that. Let's take you back to the health sector now, and it is a sigh of relief for more than 1 million Kenyans living with HIV after the government reached an agreement with the United States Agency for International Development, USAID, over a tax waiver for the supply of HIV and AIDS drugs. The dispute saw drugs for Kenyans living with HIV worth 2.1 billion shillings held at the port of Mombasa, threatening the lives of patients. The government of Kenya has accused USAID of using private companies to import the drugs, thus flouting regulations on tax waivers on government-to-government donations. Our health and science reporter Gloria Milimu has more.
After months of uncertainty, people living with HIV/AIDS in the country can breathe a sigh of relief following the government's move to waive a tax on the disputed cargo of drugs worth 2.1 billion shillings that lay stuck at the port of Mombasa following a tax row between the Kenyan government and the US donor USAID. Treasury CS Sukuria Tani says, and I quote, "Earlier today we approved tax exemption to the concerned ministry following their request," end of quote. The Treasury boss further says, and I quote, "Treasury has the powers to waiver pay for unique situations where there is immense public interest involved," end of quote. And in what now seems to be a move to avert a similar incident, Health Cabinet Secretary Mutahi Kagwe says, and I quote, "I welcome the resolution of the ARV stalemate. As government, we must take a look after our own people in order to avoid such situations in future. Local manufacturing is the way to go," end of quote. Homa Bay Chief Executive for Health Professor Richard Muga shared Kagwe's sentiments, calling for a sustainable solution to ensure no future disruption of distribution of such medicines.
And we have also made an appeal to the American government that they should continue to support the availability of ARVs. Now, gradually, I am sure the government of Kenya will begin to work on a process that creates a fund that could be able to pay for ARVs.
A row ensued between the Kenyan government and the donor following allegations of USAID failing to use government protocols on HIV and tuberculosis drug donation and opting to use a private firm to ship the commodities. The antiretroviral drugs arrived in the country on January 18th but had not been cleared, leaving the life of people living with HIV who depend on the drugs hanging in the balance, as it was not clear when the tussle was going to end. Part of the consignment that was stuck at the port included 258,954 packs. Currently, 1.5 million people are living with HIV in the country, 1.3 of these being adults aged between 15 and 64 years, and children between the age of 0 and 14 years, account 139,000 of people living with the disease in the country. Gloria Milimu, KTN News.
Residents of Tiati in the county